you some discharge instructions since you just had a baby. For your diet, adequate nutrition is good for your body to heal. You should eat foods high in fiber, which include bran, broccoli, cauliflower, and fruits to help your bowel movements become regular. Eat foods rich in calcium, which include dark leafy green vegetables, milk, and yogurt. Drink plenty of water and non-sugar supplemented juices each day to satisfy your thirst and maintain hydration. Avoid soft drinks, coffee, tea, and alcoholic beverages. For your activity, gradually increase your daily activities until you're back to your normal routine. Rest frequently. No lifting, pushing, or pulling for the first 2 to 6 weeks or as instructed by your physician. Do not drive until you are released by your physician. For your breast care, your breasts and nipples may have changed and or grown in size during your pregnancy. Wearing a well-fitted, supportive bra day and night may be more comfortable as your body adjusts to these changes. Wear breast pads until your breasts stop leaking. Leaking may occur for several weeks to months. You may apply ice packs between feedings to ease discomfort. If you are not breastfeeding, wear a well-fitted supported bra for at least 3 to 4 days following your delivery. Refrain from stimulating the breasts and nipples. Do not pump breast milk or permit the newborn to suckle to alleviate engorgement. Apply cold compresses in a form of a frozen wet towel, cold packs or ice packs for 15 minutes at a time, every hour as needed. To prevent tissue injury, do not apply cold directly to the bare skin. Do not massage or apply heat to the breasts. If you are breastfeeding, your baby's mouth should form a tight seal. The lips should be against the areola, not the nipple. If the baby is sucking incorrectly, slide a finger between your baby's lips and your breast to break the suction gently. Reposition and try again. How long? As long as your baby wants, which is usually 10 to 30 minutes. At first, your newborn will probably want to nurse many times in a 24-hour period, though not for very long. It is important for the health of your breast to have your infant feed from both breasts every feeding. Good signs of nursing: hearing your baby swallow without a clicking sound, seeing movement above the baby's ears, the ears may even wiggle, and not seeing dimples in your baby's neck. You and the baby should appear calm and relaxed during the feeding. You should feel gentle tugging at the nipple, but no pain after the first few minutes. If you do feel pain, it may be the baby is not positioned properly or that the tongue does not extend past the lower jaw. Remove the baby and begin again. For hygiene, wash your hands frequently when caring for yourself. To prevent infection, always wipe from front to back after using the toilet and clean your bottom with warm tap water using the peri bottle after urinating or having a bowel movement. It is important that you change your pad frequently. Bleeding. The vaginal flow will decrease in amount from bright red to pinkish or brown to yellow or cream color. Your menstrual period may occur as early as 6 weeks to 2 months after the birth of your baby. For your bowel movements, avoid constipation. You may need to take a mild laxative or a stool softener until bowel movements have returned to your normal pattern. Increase fluid and fiber in your diet. Birth control. Discuss your birth control options with your healthcare provider. You may choose to obtain a method of birth control before resuming sexual intercourse. For sexual activity, nothing should go into the vagina for the first 6 weeks after discharge. Sexual intercourse should be avoided until bleeding has stopped and the woman feels physically and emotionally ready. Warning signs to report to your healthcare provider immediately include pain, redness, warmth, swelling, drainage, or foul-smelling discharge from the incision or the incision begins to open, perineal laceration or a C-section incision specifically, discharge from the vagina that has a bad odor, severe headache or blurred vision or visual changes, a temperature over 100.4, or you may feel cold or feverish and have chills, thoughts of harming yourself or a baby, pain or burning sensation, redness, warmth, or swelling in the legs, breasts that are painful, swollen, hot, tight, itchy, or have sore spots with redness or red streaks and flu-like symptoms, sharp pains in your abdomen, breast, or chest, trouble breathing, dizziness or faintness, crying spells or mood swings that feel out of control, unable to empty your bladder or urination that is painful, difficult, or too frequent, difficulty having a bowel movement. And if you are experiencing domestic violence or abuse, please call 1-800-96-ABUSE. For your neonatal discharge teach-in. For safety, sleeping, place your infant on his or her back to sleep. Use sleep clothing such as a one-piece sleeper instead of a blanket. Do not let anyone smoke around your infant. Bless you. Use a firm mattress and a safety-approved crib covered by a fitted sheet. Car seats and other sitting devices are not recommended for routine sleep. Do not use pillows, blankets, or pillow-like bumpers in your infant's sleeping area. Wedges and positioners should not be used. Keep soft objects, stuffed toys, and loose bedding out of your infant's sleep area. The baby should sleep in the same room as the parents, but not the same bed. Avoid covering the infant's head or overheating. For the bulb syringe, keep the bulb syringe near the infant at all times to clear the infant's throat or nose if necessary. Clean the bulb syringe with a warm soapy water after each use. Allow it to air dry. For hand washing, wash hands prior to handling the neonate. For car seat, all infants are required by law to be in a car seat while the car is in motion. Children should be placed in a child safety seat according to state laws. At home, the use of outdoor announcements is not recommended to announce the birth because they call attention to the presence of the new infant at home. Question any unfamiliar person visiting your home or inquiring about your baby after discharge. Do not use home monitors or commercial devices marketed to reduce the risk of SIDS. For behavior, crying is a normal response for your infant to cry. The most likely causes of crying are hunger, the need for a diaper change, or the need to burp. You should burp your baby after each feed. Calming techniques include feeding your infant, changing the diaper, gently rubbing the back of or tummy, walking with your infant, rocking your infant, skin-to-skin contact, or giving your baby a pacifier. It is never okay to shake your infant. If you get frustrated or angry, put your infant in a safe place. Take a break and call a friend. For sleep patterns, infants require a lot of sleep. You should be waking your baby at least every 3 to 4 hours for feeding. You should place your baby on his or her tummy for each day for supervised tummy time. This will strengthen his or her neck and abdomen. For the diet, breastfeeding. Your infant should be breastfed 8 to 10 times a day per the infant's cues. Positioning. Be sure to hold your infant close to you while feeding. Your infant needs to be cuddled and skin-to-skin time is recommended. After feeding, hold your infant upright over your shoulder while gently patting or rubbing his back to burp. Formula feeding. Your neonate is receiving a Similac or Enfamil diet. Your baby sleeps longer than 4 to 5 hours and misses feeding. Awaken your baby to feed. Your infant will generally take 2 to 3 ounces per feeding after the first few days of life and will need to eat every 3 to 4 hours. For positioning, be sure to hold your infant close while you're feeding. Your infant needs to be cuddled. Never prop your infant's bottle to feed. For burping, infants need to be burped every half ounce of formula. After feeding, hold your infant upright over your shoulder while gently patting or rubbing his back to burp. Newborn characteristics include a newborn rash. It is normal for your baby to develop a rash on his or her skin. It appears as a small, red, circular area with white dots in the middle. This condition does not require treatment and typically resolves within the first week of life. Avoid lotions, powders, and perfumed soaps. Malia. Malia are small, pearly white bumps typically found on the face, especially the nose. They will disappear within the first week of life. For jaundice, it's a common occurrence in newborns. Your infant may appear to have a yellow coloring to his or her skin. It will start in the face and progress down to the toes. If your infant appears more yellow within the next 24 hours, please call your health care provider immediately. Infant care includes bathing. Your infant will need to be sponge bathed until the umbilical cord falls off. Using a soft washcloth washcloth, and plain water, gently wash your infant's face. Bathe your infant from head to toe, saving the diaper area for last. Mild infant type soap may be used on your infant's body. For cord care, keep the umbilical cord clean and dry. Cleanse with warm water and soap when soiled. Inspect the cord and surrounding skin with diaper changes and notify the pediatrician if drainage or discoloration is noted. The umbilical cord will generally fall off within the first 2 weeks of life. For wet and dirty diapers, 1 to 2 wet diapers are normal for the first day or two of life. Day 3 and 4 should have 3 fecal and wet diapers. Then you should expect to have 6 to 8 wet diapers of pale urine every day. Over the next few days, your infant's bowels will begin to change from a yellow-green to a mustard yellow and will soften in consistency. Your infant should have at least 1 bowel movement every 24 hours. You may want to keep a record of your infant's wet and dry diapers to monitor adequate elimination and hydration. Genitalia. The female, always wipe the baby front to back. Be sure to cleanse all creases and folds to prevent diaper rash. Pat dry and diaper. It is normal for baby girls to have a white or pinkish discharge. The secretions are normal and will gradually disappear. For males uncircumcised, always wipe the baby front to back. Be sure to cleanse all creases and folds to prevent diaper rash. Pat dry and diaper. For males that are circumcised, always wipe the baby from front to back. Be sure to cleanse all creases and folds to prevent diaper rash. Pat dry and diaper. Vaseline gauze is applied to the circumcision every diaper change for approximately 24 hours. The head of the penis will appear red initially and then will change to have a yellowish sticky film. This is very normal. If you experienced bright red bleeding or green drainage, contact your healthcare provider immediately. The plastic ring method of circumcision does not require a dressing. The ring that is used will come off usually by 2 weeks. If you notice swelling, bright red bleeding, or green discharge, contact your healthcare provider immediately. To cleanse the area, wipe gently with a soft cloth, cotton swab, or gauze pad, and plain water. Dress your infant as you would yourself. Avoid overdressing your infant. Too much clothing and too much blankets may cause your baby to become overheated. For vaccines, all infants should receive recommended vaccines. Warning signs to report include difficulty breathing, rapid labor or noisy breathing, feeding issues, inability to feed, persistent vomiting, or refusal to eat, temperature concerns, a fever over 100.4 Fahrenheit, or low body temperature below 97.7 Fahrenheit. Jaundice is yellowing of the skin or eyes, especially if it appears within the first 24 hours. Unusual crying, high-pitched or inconsolable crying. Skin changes include rash, blisters, or unusual markings. Lethargy is unresponsiveness or extreme sleepiness. Dehydration signs include fewer than 6 wet diapers in 24 hours or a dry mouth. Seek help when any of these signs occur. Always trust your instinct, and if something feels wrong, seek medical advice. Do you have any questions for me? Okay, congratulations!